Having trouble breathing? Just breathe this in, okay?
For too many African Americans and other people of color, for too long, the simple act of taking a breath is a continuing struggle.
Pretty bad obstructive disease. Have you ever been intubated before?
This is a quote that Martin Luther King did in 1964. And I would argue that this is no less apropos almost 50 years later than it was then. That of all the forms of inequality, injustice in healthcare is possibly the most shocking and inhumane.
And it is perhaps most shocking when one looks at asthma.
It's now estimated that 25 million people have asthma. We know that in certain inner city census tracts, asthma may be as high as 20% among African American children. We know that African Americans as a group are 2 to 3 times more likely to be admitted to the emergency room, the hospital, or the ICU for asthma, and about 2 times as likely to die of asthma. I'd like to thank you for being here. I'm Dr. Leroy Graham from Atlanta, Georgia. I'm the founder and medical director of Not One More Life.
For more than 10 years, Dr. Graham and his team have gone from city to city teaching healthcare providers about asthma care and spreading the gospel to patients that asthma need not control and threaten their lives. This night, he was in Oakland, California.
I saw people that clearly needed to be on more medicine, less medicine, or better medicine. And I saw a lack of kind of the personalized care that I think comes not just from the fault of the doctors, but people being energized and engaged participants in their own health care. That's what I saw. I think we sometimes, as people of color, for a variety of reasons, have lowered expectations. And we're okay with good enough. But the tragedy is, it's not good enough.
Teaming up with local doctors, nurses, and other volunteers, Dr. Graham employs a very systematic approach to demonstrate the basics of high-quality asthma care.
We explain some of the basics of asthma, talk about medications, and do it in a very conversational format.
Do you think that you'll be able to fill this out, or would you need some assistance?
Then after that, we like the participants to go to our screening stations, where they then get a symptom assessment.
Let's just put it in for blow hard.
Then we do an objective lung function test called a spirometry, a test that might cost as much as $200 in a physician's office.
So you just got out of the hospital a couple of days ago?
After that, they go and sit down with a physician who then reviews the lung function test, the symptom assessment, and lets them know if there is an issue here, and what that issue might be, and what are the next steps.
This is a beginning, not an end. If there is a problem, Dr. Graham's team follows up with the patient several times during the next year. And if they have a primary physician, Dr. Graham sends a report.
We don't want to disrupt that relationship, we want to empower that. So we basically give them a written report to take back to their physician, and then we let them know this is where this came from, and they can contact us.
Where Dr. Graham and his team perform their work, churches, is almost as important as the work itself.
There are places where people feel willing to come in, places that they know historically have met not just their spiritual, but often their physical needs. So if I want to establish an effective education, an effective outreach screening and outcome monitoring program, I need to have that type of validated partner.
In Oakland, it was the Acts Full Gospel Church. Bishop Robert Jackson is the pastor.
God said, my people are destroyed because of the lack of knowledge. And I think knowledge, this type of knowledge that we gain from having this type of a seminar, health seminar, especially centered around asthma for our community, has been just, we just can't put a price on it, how valuable it's been.
I found the church is very receptive. Their leaders, rabbis, imams, pastors, all have a strong vision for the spiritual and the physical health of their congregants. And basically that has resonated and has opened doors for us and had people come in kind of expecting to get something.
Overall, Dr. Graham and his Not One More Life team have conducted more than 200 programs, involved more than 6,000 patients in more than 15 cities nationwide. In each place, he has successfully planted a seed.
In each expansion city, what we try to do is raise up a team in that local community that can then replicate our program going forward. It's not a one-off. Basically, what Not One More Life is a template that we bring to communities that they can build on and oftentimes make better. Not Woman Life is important because it is about empowerment. It is about engaging people and having people become empowered to be active participants in their own health care.
Probably telemetry or ICU, just to keep an eye on him overnight, make sure he continues to get better.
Because the simple fact is, absolutely no one should die of asthma.
Indeed, no one should die of asthma. If you want to join and support this effort, please contact Not One More Life. Our email address and phone number are on the screen.